Are you currently undergoing a thigh lengthening procedure and experiencing a burning or numb sensation on the outside of your thigh? It is most likely myalgia paresthetica, an irritation of the cutaneous nerve that supplies the outer side of the thigh, which can easily become compressed during a thigh lengthening procedure due to increased muscle tension. A cutaneous nerve, the lateral femoral cutaneous nerve, is responsible for sensation on the outer side of the thigh and can cause these symptoms when irritated. Sometimes it feels like burning, other times the area is simply numb. The nerve runs along a very strong hip flexor and then crosses over the iliac crest before finally innervating the skin area beneath the lateral muscle of the thigh. Along this path, there are two narrow points where increased muscle tension in the hip flexors or in the lateral area, the ITB, can lead to compression. What can trigger these symptoms? During a thigh lengthening procedure, there is increased tension in the muscles, which compresses the nerve and presses it against the inguinal ligament or the iliac crest. This phenomenon usually occurs during a thigh lengthening procedure only on the side where the tension of the ITB or the hip flexor muscles is particularly high. It rarely occurs on both sides at the same time. What helps when these symptoms appear? Since the symptoms are caused by increased muscle tension, the best way to relieve them is to reduce this tension. Focus your stretching exercises on the ITB, the lateral area, and the hip flexors. Non-steroidal anti-rheumatic drugs often help as well. However, their use should be limited to just a few days. Pregabalin also has a very good effect on these symptoms. However, it is important to realize that any medication only treats the symptoms, not the cause, which is increased muscle tension. Ultimately, these symptoms are very unpleasant, but they should be understood as a sign of increased tension and should motivate you to continue with stretching exercises. As soon as the muscles become more flexible again, the symptoms will also subside. However, it is important to avoid exposing the nerve to permanent and very strong compression, as otherwise nerve regeneration can take a very long time even after lengthening.